Have you ever wondered how a pill knows exactly where the problem is inside your body? How does a medication travel, find the diseased area, treat it, and then safely leave your body? In today's video, we're going to answer that question by following the incredible journey of a drug, from the moment it enters your body until the moment it exits. Before we begin, don't forget to like this video and subscribe to the channel. It really helps this content reach more people who can benefit from it. 1. How drugs enter the body. There are several ways medications can enter the human body. Some drugs are taken by mouth, such as tablets, capsules, or liquids. Others are given by injection, whether into a muscle, directly into a vein, or under the skin. Some medications are inhaled, like asthma inhalers or nebulizer treatments. Others are administered as suppositories, either rectally or vaginally. And finally, some drugs are applied through the skin, such as creams, ointments, or patches. Although these routes may look very different, they all share one main goal: to deliver the active drug into the bloodstream. In this video, we'll focus on the most common route: oral medications. 2. From swallowing to absorption. Once you swallow a pill, it travels down to the stomach. Inside the stomach, powerful acids and digestive enzymes begin breaking down the pill or capsule, releasing the active ingredient inside it. From there, the medication moves into the small intestine, and this is where the real magic happens. The lining of the small intestine is specially designed to absorb substances. Here, the active drug is absorbed through the intestinal wall and enters the bloodstream. It's important to know that all other drug routes aim for the same destination: the blood. The only difference is speed. For example, a drug injected directly into a vein enters the bloodstream immediately, without passing through the stomach or intestines. 3. The liver, the body's chemical factory. Once the drug reaches the bloodstream, it doesn't go straight to work yet. First, it must pass through one of the most important organs in your body, the liver. This is where the second stage begins: metabolism. Drug metabolism may sound complicated, but let's simplify it. Medications cannot simply roam freely inside your body. That could be dangerous. Some drugs enter the body in an inactive form. These drugs must be processed by the liver to be converted into an active form that can actually treat the disease. Other drugs are already very active or powerful. If left unchanged, they could cause toxicity. In these cases, the liver reduces their activity and neutralizes part of their harmful effects. After this process, the liver releases the modified drug back into the bloodstream. 4. Distribution: how the drug travels everywhere. Now comes the third stage: distribution. The drug circulates with the blood and reaches every part of the body, not only the diseased area, but healthy tissues as well. 5. How painkillers find the source of pain. Imagine you get stung by a bee or injure part of your body. That injured area starts releasing a chemical called prostaglandins. These chemicals stimulate nearby nerve cells, which send pain signals to your brain, and that's how you feel pain. When you take a painkiller, it enters the bloodstream and travels throughout your body. Eventually, it reaches the area producing prostaglandins. The drug binds to specific targets there and blocks the production of prostaglandins. As a result, nerve cells stop sending pain signals. The brain no longer receives the pain message, and the pain is reduced or disappears. This is just one example. Different drugs work in different ways, using highly specific biological mechanisms. 6. How drugs leave the body. The final stage of the drug's journey is elimination. Drugs can leave the body through several routes: stool, sweat, saliva. But the most important exit route is the kidneys, through urine. However, drugs cannot be excreted by the kidneys in their original form. If they were, they could clog the kidney filters and cause serious damage. So, once again, the drug passes through the liver. The liver converts the drug into smaller, water-soluble particles that can safely pass through the kidney filters without causing harm. These particles are then eliminated from the body in urine. Conclusion. And that completes the incredible journey of a drug inside the human body, from swallowing to absorption, metabolism, distribution, and finally, elimination. If you found this video helpful, don't forget to like, subscribe, and turn on notifications so you never miss our future medical videos.